afternoon, everybody. My name is Drew Shockley, and I'm with Move Health. And if you are here for the early retirement webinar, you've joined the right place. We're excited and pumped and ready to spend a little bit of time with you all to talk about all of the healthcare options that you have in early retirement. Helping me today is Josie Living Good. Josie Living Good is down in Texas. She leads all things marketing at Move Health, and so she's going to be monitoring the chat. She's going to be monitoring, any questions that might come up, anything that you might want to discuss. And she has already put some messages in the chat. So if you're not familiar with Zoom, down on the left side, or just so everybody knows, you can see me, but I can't see you. So that's okay. I'm sure you're all out there smiling, beautiful faces, ready to learn all things about early retirement healthcare coverage. But we are in webinar mode. So the only way to interact with us is through the webinar chat. So wherever Josie is putting her messages, you should be able to see down at the bottom of your screen. You should see a little chat function, and you should be able to interact there. If you will, go ahead and type a message in here. Where are you from? Where are you logging in from? I will tell you, I'm logging in from Evansville, Indiana today. So I'll put it in just like that. And then so you'll be able to see that. All right, there we go. Aaron is from Arizona. James from Texas. Mike is from San Diego. Megan from Tampa, Florida. We've got people from all over the place. And so there's a number of you that have joined, and we're expecting a number of others to join, but it's a couple of minutes after the hour. And so we are going to go ahead and get started right away. So Josie, thank you for putting this together. Everybody, thank you for joining. Let's dive in. So this is our beautiful slideshow for the day. Again, this is titled Early Retirement Healthcare Coverage 101 for Pre-65 Retirees. And again, you're going to learn a lot about us today. So here's a little bit of breakdown of all the things that we're proud about here at Move Health. So if you look at our founding team, we have over 100 years of experience in the healthcare, health insurance, Medicare industry. We have built a SOC 2 Type 2 compliant platform that has interactions and engagements with financial advisors and clients. And what that platform does is it provides guidance for people in the pre-65 healthcare space, which is what we're going to be talking about today. But I do want to highlight that we do serve clients in the Medicare space as well. So those that are turning 65 or 65 or older, or maybe they've went on to Medicare due to a disability, we do serve clients in the Medicare space. In this this particular webinar, we're not going to talk a whole lot about it, but we do serve clients for dental and vision coverage and other ancillary type coverage. So anything healthcare related, we got you covered. If you look at our platform, we are a wealthy, award-winning platform recognized for innovation, and our services and our team and everything is we've all been featured in a number of publications over here on the right. So the Journal of Financial Planning featured on wealthmanagement.com, the Vetify Advisor Perspectives, the NAFA Advisor Magazine, Plan Advisor, Rethinking 65, all kinds of things. But the thing that I'm probably one of the most recent things, and one of the things I'm super proud of, is the most recent T3 Technology Tools for Today survey. And there were two things that came out of this. Number one, we were ranked as a software all-star because of our rating with clients and advisors. And when it came to the healthcare planning category, which Josie was very integral in getting that category added, included in the survey, Move Health had the most market share and the highest rating of any other technology platforms that's built for the healthcare and Medicare space. And so super proud of what Move is doing. We have an incredible team. I'm one of the co-founders, and I do things outside of work as well. This is my family. Here's my beautiful wife Jessica, our two boys Mason and Max, and I've been in the healthcare insurance industry for about 20 years. I started a little bit more. I started in the fall of 2005 working for Anthem Blue Cross Blue Shield, and that's where I got my start. After a couple of years, I've been the founder of 3 healthcare startups, with the first one beginning in 2008. And so this is the only space that I've been in when I'm not doing healthcare, Medicare planning, those types of things, and working, you can find me typically at a soccer field or on a golf course. Or one of the things we love to do in the summer is go to the lake. So I am a real person. I'm normal. I'm not AI. This is my family, and I guess that supposed to prove the point. But that's enough about me. I'm ready to dive into today's content. Okay, we're going to have some key learnings. So if you're a note taker, this would be the time to grab your notes, grab a pen, grab a pencil, whatever it may be. This is the time to do it. And so our first key learning is going to be talking about pre-65 health insurance basics and the options that clients or people in this particular category can look into whenever they're in this window. Okay, so key learning number one. First of all, in order to understand about the health insurance options in the pre-65 category, we have to understand how people buy health insurance as a whole. Okay, so this is some statistics here that are coming from the Kaiser Family Foundation. So if you're into this stuff and you want to learn about it, you can go to kff.org. You can specifically look into state health facts. But if you do, you will look at the total population of the United States, which is around 330 million people or so, and you will find that 50% of people buy their health insurance through an employer. Okay, so 50% of people are covered by an employer group health insurance plan. Okay, that's a lot of people. It could be as an active employee, could be as a spouse, a dependent, or maybe even a former employee, right? So sometimes companies offer a healthcare extension. It's pretty rare these days, but it happens. But this would be considered in this particular category. Okay, but right away we're knocking off 50% of people that are covered through their job. Okay, 20% of the population is covered today by state Medicaid programs. Okay, Medicaid is low income health insurance plans for people in a particular state. Typically, this is adults or kids below certain income levels. And so you can see some of the examples, but we have about 20% of the population that is covered by state Medicaid programs. Okay. This is a really, really interesting fact, but a lot of states have expanded their Medicaid programs over the last several years. And so this has been, an area that we've seen pretty significant growth. And, it's just something for you to keep your eye on. Typically people from this, this segment, we're not going to be talking about Medicaid a lot. We work with a lot of clients from financial advisors. So these are mid to high net worth individuals. Medicaid is not something we're dealing with on a regular basis. Hi, Bev. Thank you so much for the question. Yes, we're going to be providing a recording of this, I believe, and Josie can answer that live as well. So, all right, 50% covered through their job, 20% covered by Medicaid state programs. What else do we have? Well, this is a pretty big category. We love this category. Medicare. There's a difference between Medicaid and Medicare. Medicare is the federal program. Okay, this is the one that we're all paying for so that we can utilize it whenever we become age eligible. Okay, so like that's typically age 65. That's when you would become eligible for Medicare, and that's when you would move into the Medicare program. People can be on Medicare earlier if you've been disabled and unable to work. So you have to kind of have disability for 24 months, typically 2 years, and you could become Medicare eligible. But this type of clientele, this is the area that we work with whenever we're working with Medicare supplements, Medicare prescription drug plans, Medicare Advantage plans, and those types of things. So thank you, Bev. I see your note there. Thank you. I hope you have a great rest of your day. Thank you. So 15% of people are in the Medicare program. Now, 8%, any guesses? I know the answer. 8% of people have no coverage. Okay. So this is maybe not what you thought, but this is still where we are. We've been working on this the last, decade or so. We've been working on it for a long time, but 8% of the population still have no coverage today. But let's dive into the individual market. Okay. The individual market is around 25 million people. Okay. 25 million people buy their own healthcare plan. This is only about 7% of the population. So if you look at a group of 100 people, 50 of them are getting healthcare coverage through their job. Around 20 of them are going to be covered through state Medicaid low-income programs. 15 of them will be on Medicare. 8 of them will have no coverage, and about 7 of them will be buying their own plan. Okay, so when we look at a whole, it's around 25 million people. This could be people that are self-employed, people that work at small companies that don't provide insurance. There's no rule. If you have less than 50 people, You don't have to provide any health insurance coverage based on federal rules. But these people are self-employed, working at small companies, maybe gig workers, or my favorite category, and maybe where you're coming from or why you're joining today, early retirees. People that have saved up enough money, been smart, and they're retiring before they get to age 65. And so that's what we're talking about today. So what can you do? Well, unfortunately, a lot of times, this is the only solution that a lot of people have. So when you're in that pre-65 segment and you're buying your own healthcare coverage, you quit your job, a lot of people think Cobra is the only option. Now, Cobra has some pros, right? There could be some situations that Cobra could work for you. If you're retiring mid-year and you've already kind of had some healthcare costs and you've met your deductible, Cobra could be a good option for you. Cobra could be a good option for you if you are leaving an employer plan and you're very comfortable with that employer coverage and you know what it does, you know what network you can go to and doctors and hospitals, because Cobra is a continuation of the same healthcare coverage through your employer. A lot of people don't realize that, but Cobra is a law. Cobra's not an insurance company. Cobra's a law. It stands for Consolidated Omnibus Budget Reconciliation Act of 1985. That's one of my best party tricks, is telling you health insurance acronyms. But Cobra is Consolidated Omnibus Budget Reconciliation Act. It's a law. It's a rule that says if you leave an employer, then you have the ability to extend coverage. So, a lot of people like this because they're familiar with it. There's no change, and maybe if you've already met your deductible, it could be a good option. But there are some cons. There are some things that may not work. It's often the most expensive option, so that may not be good. Depending upon your situation. Typically it only lasts for a definitive period of time. The average is 18 months, or like the standard is 18 months. There are some situations where it may be a little bit longer, but typically the standard is around 18 months. And if you are Medicare eligible, Cobra is not considered credible. So you should know that, getting to 65, you should be moving to Medicare. You shouldn't be taking Cobra. The reality is the law of Cobra, the rule back in 1985, was good, and there was a lot of value. Today, it's my professional opinion is that Cobra should be rarely used because of the options that are available in the individual market. And so I'm going to tell you more about those now. Okay. If you left your job today and you wanted to buy your own healthcare coverage and Cobra was not a good option, an option would be short-term major medical insurance. Okay. There's an individual healthcare plan you can buy that's called short-term major medical insurance. This is used by fewer than a million Americans or so. Okay. So it's a pretty small sliver of the individual market. It's not a large portion, but it is a product option that is there. Typically with short-term major medical, you can get large networks, large PPO networks. Typically short-term major medical plans are lower cost than like an Affordable Care Act plan we're going to talk about in just a minute. And you can buy short-term major medical plans at any time. You don't have to go through, any sort of special enrollment period or anything like that. You can apply for a short-term medical plan, and if you're approved, you can get coverage as early as the next day. Okay, so we use short-term major medical at times, but it's for a pretty small, percentage of people. People that are getting short-term major medical plans, you have to know that short-term plans are not ACA compliant, so they don't meet all the guidelines. They also don't cover pre-existing conditions. They don't cover pregnancy or prescription. So we always kind of say internally, they don't cover the 3 Ps: pre-existing conditions, pregnancy, or prescription drugs. So oftentimes that can be an issue for a client. And most of them are medically underwritten, which means, you have to apply for them and you have to be approved. So not everybody could be approved for short-term medical plans. This is why they're used by a small percentage of people. Next, healthcare sharing programs. Okay. So this is roughly, used by around 2 million Americans. Healthcare sharing programs are non-insurance alternatives for individuals and families. Okay. So this is a very common thing. We work with one of the largest healthcare sharing programs. Healthcare sharing programs are often half the cost of Affordable Care Act compliant plans, which we haven't talked about yet, but you may be aware of them. So a lot of people look at that healthcare sharing programs because of this. Typically, healthcare sharing programs have large or generally no networks. So you can kind of go to any provider that you want, or you can, the ones that are in the network of the healthcare sharing program, you might get a reduced cost. You can enroll in a healthcare sharing program generally at any time. There's no special enrollment. And so it can be a good option. The cons or the issues that you may find with it, They're not ACA compliant. They don't cover pre-existing conditions. Generally, there's no coverage or guarantees because it's not insurance. And you have to really be careful with a lot of smaller programs that are out there in the healthcare sharing programs. Here at Move Health, we only work with one. We work with the largest healthcare sharing program, and that program has almost 500,000 members. So they're by far the largest, from a healthcare sharing, program perspective. But if you're considering this, make sure that you, are really, really careful with smaller programs. Okay, last and not least, but last, Affordable Care Act compliant plans. If you're buying your own individual coverage, you got COBRA, you got short-term medical, you've got healthcare sharing programs, you've got Affordable Care Act compliant plans. This is used by around 23 million Americans, or 92% of the individual market. If you remember back, we had like somewhere in the neighborhood of 25 million. Well, 23 million are in Affordable Care Act compliant plans. These are AKA, also known as Obamacare plans, the Affordable Care Act marketplace or marketplace plans or ACA plans. Okay. There's a lot of really good things about this. Number one, they're all guaranteed and required by federal law to cover pre-existing conditions. Okay. That's a big one. Rates are only based on your age and where you live and if you use tobacco or not. They're never based on your health. Okay. There's no underwriting or anything like that. It's based on your age and where you live. A lot of people in the individual market are eligible for healthcare premium tax credits or subsidies. And if they are, this is oftentimes the most affordable option. So we're going to talk about that a little bit more in a second. This allows for people to manage their modified adjusted gross income to help reduce premiums. So this is like one of the main things that Move Health does. We teach financial advisors and clients how to manage or reduce modified adjusted gross income so that you can make Affordable Care Act compliant plans more affordable and leverage the premium tax credits that we're going to learn about in just a second. Now, cons, generally, Affordable Care Act compliant plans can work on state-based networks or restrictive networks. So like EPO, HMO, POS type things. That's generally, an issue in some cases. Oftentimes, whenever somebody's getting a sizable tax credit, it just adds a little bit of layer of work to do during tax time. But at this point, 12, 13, 14 years in, accountants are very aware of how to do that. It's not really that big of a deal. And then from an Affordable Care Act compliant plan perspective, it can, result in higher out-of-pocket costs than what a client might have seen through an employer-based plan. So, these are all things that we help navigate, in the individual market. And so, when you're looking at that, the key learning number one was like, how do people buy insurance? What are the options? COBRA, short-term healthcare sharing, or Affordable Care Act compliant plans. That is key learning number one. So ACA plans, we're going to talk about this just a little bit more. ACA plans are guaranteed issue because of the Affordable Care Act, right? It happened in 2010. And the marketplace was created in 2014. So nobody can be denied health insurance coverage in this particular market. As I said in the slide before, rates are only impacted by your age and location and tobacco use. And, there's a number of carriers that offer plans through the marketplace. So we're not getting government insurance. We're getting coverage from, some of the nation's top insurance companies. It's just through the Affordable Care Act bucket. Okay. So key learning number one, COBRA, short-term healthcare sharing, Affordable Care Act, and kind of what's going on there. Key learning number two, we're going to talk about advanced premium tax credits. Okay. We're going to take a second here. Just a quick break. I'm going to take a drink of water. We're not going anywhere. Stay with me. If you're still in the chat, put a hey or put a hi or something in the chat out there just to make sure I've still got you. But we're going to dive into to key learning number one. Does anybody know, how much the average advanced premium tax credit is? Thanks, Aaron. Thanks, Kimberly. Well, I'm going to tell you just a little bit about this, and I'm going to show you an example. Okay, so what are the advanced premium tax credits? Well, they've been around. They were created with the implementation of the Affordable Care Act in 2010. And they were rolled out in 2014 through the federal marketplace. So the only way for you to get the advanced premium tax credit is to apply for a health plan through the federal marketplace. Advanced is a key word because it's not a credit that you like apply for and you get later. It's not a credit that you like go and file your taxes and then you get like a refund. Okay. It's advanced. So it means that they're applied immediately to the cost of healthcare coverage and they directly lower monthly premiums right away. Okay, so this is pretty key. Advanced premium tax credits exist to really offset the cost of plans. So like before the Affordable Care Act, you know, plans were different. Plans were priced differently. You know, maybe some people couldn't go through the process of getting underwritten, and maybe pre-existing conditions kept them away. And oftentimes there were cases where people could not afford, private insurance or buying healthcare coverage. So advanced premium credits were designed to offset the cost of marketplace plans, encourage people to enroll to kind of balance the insurance risk pool, and reduce the number of uninsured Americans. So there's lots of things that we did here, but the main thing with the Affordable Care Act and the APTCs, it's funneled or funded through the federal tax system. So it's a tax credit that you get that's tied to income. So let's talk a little bit about how they work. Now, well, number one, you have to estimate your household modified adjusted gross income for the coverage year. So it doesn't matter what you made last year or the year before. There's no influence there. It's for the coverage year. So if you're enrolling in 26, it's based on 2026. The marketplace, with the help of a certified agent, calculates your premium and your advanced premium tax credits based on a sliding scale. Then the federal government through the APTC program, sends that credit or whatever you apply for to the insurance company, based on your expected income, your household size, and the number of things. And then your healthcare plans are immediately reduced in real time. Okay. You do make an estimate on the current tax year. You do make an estimate, and then healthcare premium tax credits do get reconciled when you file your federal tax return. Okay. So you do have to report, you have to estimate an income, but then they're reconciled when you do your federal return for that particular year. So again, accountants have been doing this for 10, 12, 14 years at this particular juncture. They've been doing it for quite some time. So they're very familiar with it. So who's eligible for an advanced premium tax credit? This is pretty important because a lot of people are not eligible for an advanced premium tax credit. If you have healthcare coverage through an employer, Medicare, or Medicaid, you're not eligible for an advanced premium tax credit. If you remember from key learning number 1, 50% of people are on an employer plan, 20% are on Medicaid, and 15% are on Medicare. Okay. I'm originally from Tennessee, so my math is not great, but 50 plus 20 is 70, plus 15 is 85. So literally 85% of the population not eligible for advanced premium tax credits. Okay. Kind of important. Although if you don't have coverage through an employer, Medicare or Medicaid, and you do enroll through the marketplace, you may qualify for an advanced premium tax credit. Your income has to be between a metric that is the federal poverty level. Okay. So it says your income has to be between 100 and 400% of the FPL. So what's the FPL? Let's take a look at it. Before we do, let's talk a little bit about the timeline of tax credits. The very first tax credit came out in the tax year of 2014. That's when you could first sign up for marketplace plans. The law was passed in 2010, but the very first year that marketplace plans were available were 2014. This happened for 14, 15, 16, 17, 18, 19, 20. In 2021, the American Rescue Plan was passed, and we saw an increase in subsidies that were available for people over the 400% of the FPL. And then we saw a lot of changes coming through the Inflation Reduction Act, and subsidies continued through 2025. Now, there was a lot of big talk about this at the end of 25 going into 26, but what has happened is that we have actually returned to the 400% FPL income cliff. So where we live today, where we are in 2026, if you don't have coverage through a job, Medicare or Medicaid, your income has to be at or below 400% of the federal poverty level for your household size in order to be eligible for tax credits. Okay. This is a view of the poverty level at the moment. We did live in a period of time where people were eligible over 400%, but that went from 22 to 25. That's now sunset. And now we're back to the original threshold of the 400% of the FPL. So if you look on the left, you'll see on the left side, you'll see household size, which is over here. So household size of 1, household size of 2, and then you'll see kind of some numbers here. So this 100% is the Medicaid line for states that have not expanded their Medicaid program. But a lot of states have expanded their Medicaid program to include people up to 138% of the federal poverty level. Okay. So household size of one, household size of two. So if you're an early retiree couple and you're looking to figure out what your income needs to be in order to be eligible for advanced premium tax credits, the current number is $84,600 of modified adjusted gross income. Okay. Modified adjusted gross income is very specific. There are things that are included, and then there are things that are not included. But essentially, it is your adjusted gross income with the inclusion of any non-taxable Social Security or foreign income that you might have. But it's essentially your adjusted gross income. So if you have deductions, or you have, if you give to your church or nonprofit organization, if your income is 100,000, but you have 30,000 in deductions, then your modified adjusted gross income could be $70,000. Okay. Your financial advisor or accountant or somebody on your team, would be able to help you kind of understand how this would work, and how you could take advantage of this. For a single person, the number is 62,000. Household of three, the number is $106,000. Okay. So this is kind of the threshold right now. The Medicaid thresholds are over here, 100 or 138. There are some really, really interesting things that occur at 250% of the FPL. So I just want to highlight that real quick. There's something called cost share reductions or silver cost share reductions that as your income goes down, you qualify for additional credits and deductible reduction and things like that. But we don't have enough time to kind of walk through that today. But this is a view of the 2026 federal poverty level chart and what modified adjusted gross income would need to be. And this is where we live today. Any questions, please put them in the chat. We're monitoring the chat. We're monitoring the Q&A. We're monitoring anything. So if you have any questions, comments, anything, please put them in chat. I'm happy to address them live, or we're happy to address them at the end. So let's look at a case study here. Okay. So this is very, very common. This is what a lot of people will see whenever they start to view health insurance coverage and they're shopping for coverage. So this is a early retiree couple, and we put them in Nashville, Tennessee. This is a 62-year-old male, a 62-year-old female, early retiree couple living in 37011. When you look at the cost of their healthcare coverage without any premium tax credits, the average cost of a silver level plan is $2,463. I've got that highlighted in the middle here with the red circle around it. This is assuming this particular clients are not leveraging any type of advanced premium tax credits. This is assuming that they're ineligible because their income is too high to be over $84,000. However, in many, many cases, we have clients that are making a transition from working, a career, a job, a business, whatever that might be, and they're moving into the next phase of life. If they're working in conjunction with a financial advisor or an accountant or somebody that helps them manage their finances, in many, many cases, they're able to manage their income down below that modified adjusted gross income threshold. And it makes a pretty big impact when you start looking at advanced premium credits. If we look at it this way, healthcare coverage is almost $30,000 a year. A lot of these people might be like, hey, 30 grand a year for a health insurance plan. I'm okay. I'm just gonna stay where I am. I'm just gonna keep working. However, I'm gonna show you the power of advanced premium tax credits and how things can be shaped just by utilizing modified adjusted gross income management. Okay. This shows the client getting their modified adjusted gross income down to $84,000. How do they do that? I don't know. There's a lot of strategies you can use from an effective income management strategy. You can use Roth conversions. You can use rollovers. You can use cash reserves. Your investment strategy could be all over the board. But a lot of people are able to do this with an effective income management strategy and make a pretty significant difference. You'll see this particular case, same client, 62-year-old male, 62-year-old female, at an $84,000 modified adjusted gross income. They qualify for $1,913 a month in an advanced premium tax credit to help offset and or pay for the cost of their healthcare coverage. That's $22,956 a year just by utilizing effective income management. Whenever you start looking at healthcare plans in that particular state, Nashville, Tennessee at this point, could be Blue Cross Blue Shield of Tennessee, could be Oscar, could be United Healthcare, Aetna. There's a number of companies that offer coverage there. Their average cost for a silver level health plan is now reduced to $549 a month. Okay. This is the power of advanced premium tax credits. And this is what a lot of people are completely unaware of. So this is how Move would work in conjunction with a client or work in conjunction with a financial advisor to help you maximize this particular time period. Now, key learning number 3, and this is the last one. It's 30 minutes after the hour, so hopefully you're still with us. Hopefully you're still taking notes. You're still there. But key learning number 3 is going to be some timelines and some action items that you or your client would need to do to take advantage of these things. Okay. So number 1, when can you enroll in pre-65 healthcare coverage? Well, for ACA plans or COBRA, you have to have a qualifying life event, right? So you have to be kind of leaving a job. It could be retirement, it could be through a divorce or maybe a death, unfortunately, but you would have a special enrollment period due to those things. If you quit working, you're going to have a special enrollment period, and that'll typically give you an option to enroll in COBRA or an Affordable Care Act compliant plan. You can enroll in healthcare sharing programs and short-term medical coverage anytime, as you saw from the previous thing. If you, generally, for retiree benefits, if you work for a company that offers retiree benefits, generally you have anywhere from maybe a 30 to 60 to maybe a 90-day window to put your retirement benefits in place. But generally for like ACA plans, you only have a 60-day special enrollment window. Okay. So when it comes to, qualifying life events such as retirement, those types of things, you have a period of time outside of that where every year in the fall, individuals, families that are out there in the individual market, they can change or enroll in a different Affordable Care Act compliant plan, regardless of life events. That period is between November 1st and December 15th. So if you're already in the individual market, maybe you're looking today and you're like, hey, I'm already in the individual market. I have an ACA plan, or I have short term, or I have something else, or COBRA or whatever, and it's not ending for a year. You can still use the standard open enrollment period in the fall from November 1 through December 15th to make a plan selection. Okay. So that's a period really for everybody, regardless of life events. But if it's any other period outside of that window, you kind of have to have a special enrollment event. So when we talk about, that annual open enrollment period in November and December of each year, who should really review their coverage annually during open enrollment? I love what Josie put in here. Spoiler alert, everybody should be reviewing their coverage. So pre-65 retirees, small business owners, anybody responsible for buying their own healthcare coverage, they should review during this period. People that are on COBRA, this is a time when you can explore leaving COBRA and buying your own individual plan. You can do that in November and December. People have had any type of recent changes. So health, medications, where you move, where you live, what those types of things, what doctors you want to go to, or particularly your income. You should review your options during open enrollment, November 1st through December the 15th. And then also people who want to evaluate high deductible health plans or HSA compatible plans. You should do that during the open enrollment period, November 1 through December the 15th. So, really anybody looking to optimize coverage or to make a change or, has any of these things that we've listed here above, you should be talking to an agent, during this period. But also if you're not leveraging the advanced premium tax credit today, and maybe you can review it and use it in the next tax year, you have to do that between November 1st and December the 15th. So, hey, what's my next step? I don't know if you're a retiree or if you're a financial advisor or whatever it might be, but if you're a client, you can contact your financial advisor and you can initiate an engagement with us. Okay. So you can start the process. Your financial advisor knows how to get a hold of us. We actually go through something called a health plan and analysis where we review your healthcare coverage needs. So we can look through provider networks, drug coverage, different carriers, costs, those types of things. And we're able to provide an analysis back to you and your financial advisor to see if you can make a transition. And so next step for you, contact your financial advisor and get them to initiate a health plan and analysis with Move Health. So it's 34 minutes after the hour. I'm going to pause right here and we're just going to open up the webinar chat and just say, hey, if you've got questions, comments, any things like that, let's put them in the chat. Again, that's the only way for you to interact with us. I can't see you, Maybe you can see me, but I can't see you. Here, I'll stop sharing. Maybe Josie, just the content was so thorough that no one has any questions, or maybe they're just holding their questions. I don't know. The only way for us to interact with you is through the chat. So if you do have a question or a comment or anything you want to say, you can do that in the webinar chat. I'm looking through now, looking to check the Q&A box. I don't see any comments in the Q&A box. We did have some good ones earlier that we handled. But here at Move Health, this is what we do. This is our mission. This is what we're doing. We're working with clients. There's a number of our licensed agent team that are here right now talking to clients every single day. So Chris, thanks, Chris. What options are available for COBRA expiring in the summer before open enrollment? So great question, Chris. So if COBRA is ending, that would be a special enrollment period where you could review Affordable Care Act compliant plans. You could go on the marketplace, get a credit, not get a credit. You could look at short-term coverage. You could look at healthcare sharing programs. But COBRA has to be coming to the end of the term. You can't just voluntarily leave COBRA and go into the Affordable Care Act marketplace. Your COBRA has to be coming to the end, or the term has to be exhausting. So that's a great question, Chris. Thank you for putting it in there. That's a confusing thing that a lot of people get wrong. If they're on COBRA and they're just like, hey, I just did COBRA because it was easy and I want to look at something else. Well, it's April currently. Unless you have healthcare, unless you have COBRA ending, the term is ending. You're reaching the end of the 18 months. You're not in a special enrollment period. So you could look at short term, you could look at healthcare sharing programs, but you wouldn't be able to look at the Affordable Care Act compliant plans until the open enrollment period in November and December. So great question. Great question. Here at Move Health, this is what we do. This is the world that we live in. We work with financial advisors and retirees every single day, and we'd love to work with you. So we appreciate you joining us. Walking through kind of these options, learning about what's available in the individual healthcare market for those in the pre-65 space. My name is Drew Shockley. We're going to say thank you for Josie Living Good as well. Josie, thank you for putting this on and also planning this and handling everything. So we thank you for joining us. I hope you have a great rest of your day, and be on the lookout for more webinars and more events that we're going to be hosting here at Move Health. And we hope to see you on the next one soon. Take care.